This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Gabaneuron Tablet is an effective medication used for managing nerve pain. It combines two active ingredients to provide relief and aid in nerve repair. Indications and uses. This medication is used to manage neuropathic pain, which may arise from various conditions, including diabetic neuropathy, nerve injuries, and other chronic pain syndromes. It serves to alleviate discomfort and improve the quality of life for individuals suffering from these debilitating conditions. How it works. The active components in Gabaneuron Tablet work synergistically to reduce pain by interfering with the transmission of pain signals and promoting nerve cell repair. Directions for use. Gabaneuron Tablet should be taken exactly as prescribed by your physician. It can be taken with or without food, and it is important to swallow it whole with a glass of water. Do not crush or chew the tablet, as this may affect how the medication works. The physician will determine the appropriate dosage and duration of therapy based on individual health needs. It is essential not to discontinue the medication abruptly without consulting a healthcare provider. Possible side effects. Common side effects of this medication may include dizziness, drowsiness, nausea, and increased appetite. If any side effects become troublesome, it is important to consult a healthcare professional. Precautions and warnings. Before starting this medication, inform your healthcare provider about any existing medical conditions, especially those related to the lungs, liver, kidneys, or heart. Pregnant or breastfeeding women should use this medication only if deemed necessary by a doctor. It is also essential to avoid alcohol consumption while on this treatment, as it can exacerbate side effects. FAQs. 1. How long will it take for the medication to start working? It may take 2 to 4 weeks for initial pain relief. 2. Can it manage diabetic neuropathy? Yes, it is effective for diabetic neuropathy. 3. What happens if I stop taking it? Stopping suddenly can cause withdrawal symptoms. Consult your doctor first. 4. Is it addictive? It has potential for abuse. Inform your doctor of any history of substance abuse. Thank you for watching. If you have any questions or suggestions, feel free to comment below. Your feedback is always appreciated.